Hi, welcome to Oklahoma Mission of Mercy. We are your restorative leads. I'm Dr. Shannon Griffin, this is Dr. Susan Whiteneck, and this is Michelle White, who's helping as the lead for our dental assistants this year. Okay, so one of the most important things for us to remember is that we are in the restorative section in a much greater clinic. We will have patients and volunteers all over the building, and it's important that the patients are never left unescorted. We will have runners that will transport patients from place to place. So when you get to your chair and identify your chair, you will find that there will be a system of cards that are there. You will use these to have patients be brought to you and also to be escorted away. Even if they need to go to the restroom, you can call a runner to go to the restroom. I'll go through these cards quickly. If you're ready for a patient to come to your chair, you would hold up the green card. Now it's important when you're using the card system that you don't hold them in a manner like this, because it might say that you need a patient on one side, but for the people behind you it looks like you're ready for your patient to leave. So make sure you hold up only the card that you're interested in using at that time. So green is, of course, when you're ready for a patient, when your patient is done, or if your patient needs to go to the restroom, you can hold up a red card. When a red card is up, a runner will come and escort your patient away from your chair. We have 3 other cards that are important for you to know. One of them, of course, is for the medical assistants. It says EMT on it. Anytime you have anything that you're concerned about where you'd like to have the medical team come over, then this would be the one that you would hold up. It's also imperative if you have a needle stick at the identification of the needle stick, you hold this up and notify one of your restorative leads so that we can get the needle stick protocol into place. The last 2 cards, which you will hopefully not need as much, but they are certainly there and very valuable, is a service technician. OkMoM has a team of technicians that will be there to do any kind of equipment maintenance that you might need. And also, if you have a patient that needs a translator, we have a team of volunteers that will act as translators. So this is how you get patients to and from. We have about 40 restorative chairs that we're trying to manage, and the doctor's coming and going, and some of you will have a half-day shift and some of you are volunteering for the entire day. So it is important that you take breaks. When you do take a break though, can you please identify on your chair if it'll be a short, perhaps a 30-minute break to go and get something to eat, use the bathroom, or if it will be longer, if it'll be more like an hour, we may be able to see a patient while you're on your break. So if you can identify in your chair with a note on a paper towel, or we may have something built into our card system by then.
When you're ready for a patient and you've held up your green card, they'll come from our waiting area, the restorative waiting area, and they'll have arrived there from triage. And triage will give them a form like this, and they will have identified an area that they feel is the first and second, third priority for treatment for this patient. And then after you've completed your treatment, at the bottom of this form you need to fill out, this is really important for our funding, the tooth numbers and the surfaces of each tooth that you work on, and then that you sign it right here.
Okay, after you arrive into our area and we give you a brief overview of the area, make sure that you look around and locate a dentist that may be there that does not have an assistant. You will not be assigned a dentist, so this will be up to you to be able to locate a dentist. We will also help you locate a dentist if you cannot find one. There are several things to look at in our area. You'll want to look around to find the central sterilization area. You'll want to find the central supply area, and just look around on all the supplies that will be on the table. Each table will be equipped with cleaning supplies and your disposable items. Please make sure that you keep those clean, as you will be sharing this supply area with 4 other dentists. You will have an amalgamator and a curing light, so each dentist will also be sharing those items. If you have one that you'd like to bring from your office, please do so, because this will also help speed your process along. Just make sure that you identify that with your name. Central sterilization is where you will locate all of your sterilized instruments, and you will return your non-sterilized instruments. Make sure that you remove all of your sharps, you remove any bloody, soiled gauzes. You will also remove your burrs from your hand pieces. Central supply is where you will locate all of your supplies. There will be a supply list out on the website that you can locate, review, and it'll tell you all of the supplies that they currently have. This is also where you'll find your burrs, your amalgam, your composites. The restorative area will have a biohazard box, and that will be centrally located. Make sure that you put all of your heavily soiled bloody gauze or any type of heavily soiled items in this. Otherwise, please make sure that you throw those into the trash can. There will be a centrally located solution that you will need to run through the suction. Make sure that you do take this and run it through for each patient. Because we are limited with the amount of equipment that we have, we suggest that you bring some of the items that you're more comfortable in using on an everyday basis. Some of the things that you might want to bring is a chair for an assistant. If you have specific gloves that you need to have, specific mask, and every assistant should have eyewear. Hand pieces, if you have any hand pieces that you would like to bring, make sure that you bring those, and they are identified with your name on those. When you do take those to the central sterilization area, you will put those in a different area, and it's a doctor sterilization area, and you will write the doctor's name on that. That way they will get returned. It will not be combined in with the other hand pieces.
A few other things you may want to consider is to maybe buy just a plastic tackle box and put your supplies in there, and that way your staff can, or your helpers, volunteers can, replace your things to that same area. But of course your instruments, clearly mark them. Things that we've run short on in the past are composite guns and composite materials, light cured bases and permanent cements. We don't use the permanent cements very often, but we need them if somebody comes in with a crown off. A cordless curing light or any curing light, your own triturator, and Toffelmeyer holders. We usually have lots of bands, not many holders. So
we are all very excited. Michelle and Dr. Whiteneck and I are very excited to be a part of your restorative team. And let's have a great Oklahoma Mission of Mercy.